Spotlight Radio Productions presents Dr. Stanley Okun. Spotlight Radio recently caught up with Dr. Stanley Okun in his Manhattan office to discuss his career, as well as his contributions to the dental field.
Hello, I'm Dr. Stanley Okun. Obviously, I'm a dentist. I do just about everything in dentistry in my office. I'm a past president of the Columbia Orthodontic Alumni Association and Board of Trustees, and was written up in Who's Who. They had a book put up of 101 specialists in the country, and I was the only dentist in the book.
What colleges or universities did you attend?
Bradley University for undergraduate, NYU for dental school, graduate orthodontics at Columbia, and graduate stuff at New York and out in Loyola.
Why were you influenced to become a dentist?
I've been around it all my life. My father, my mother's 4 brothers, dentists. 2 of my grandmother's sisters, dentists. Several of my cousins are dentists.
How has your journey encouraged you to be a successful dentist?
I was raised in Brooklyn, New York. Went to the Dwight School. Then went out to Bradley University in Peoria, Illinois. Came back to New York for my dental school. After that, I was called into the Army, where I did virtually everything in dentistry. Came out, did graduate work in orthodontics for 2 years. While I was there, I started working with my father and my uncle at the same time. Became a partner in the office. Here I am now.
What are the differences between being a military dentist and a civilian dentist?
Well, the military tries to limit what they do to battlefield standards, and that was my battle with them. My CO and myself stopped keeping track out of roughly 60 patients we want to take out the teeth, and I saved over 2.
What do you enjoy about being a dentist?
Just working with people, working with my hands. I like to limit extractions, keep things more reasonable if I can, and don't limit to everything to what I do. If need be, send something out, it's not my end. Most people do either general or one other part or another. I do everything.
What advances have you seen throughout your career?
When I started out with belt-driven engines, roughly 5,000 RPM, my uncle thought of taking the transistors out of the motors, and we got 400,000 RPM out of the same machines. Then they came the air rotors. Air rotors are roughly 400,000 RPM, but they don't have the same torque. And if you can have both handy for some things, it's better.
What advice do you have for someone considering becoming a dentist?
Be ready to work hard. You have to be personal with yourself. And it's not quite what it used to be because of the insurance system. The insurance companies use dentistry or a lot parts of dentistry, such as orthodontia, as a loss leader. And what they pay the patient, unfortunately, is very bad. Maybe $1,500 in a year, and that doesn't go very far.
Tell us about your contributions to the field of dentistry.
I was a part of 3 groups that worked on the palate expansion separately from the others, unbeknownst to each other. I found out somebody else was doing it when I was running the slide projection for somebody. And we compared notes across the audience. And it was interesting. But I found that you had a lot of people didn't use a rigid enough appliance. The labs don't like to work with the other stuff. Most of the appliances have a 036 or 040 wire. Usually, you don't get that wide. I used 050 and I-51. To make it more rigid, I covered the wires of it with silver solder. And where they claimed you couldn't open the pallet beyond the age of 12, 13, I had 100% success with girls through 16 and boys 17, 18.
How does this device expand the palate?
When you put pressure on young bone, as it is, the bone actually fractures. And you gradually open it up, and the bone gets bigger. And you have to hold it. But there are those who say it collapses. If they don't hold it long enough, it will. It should be held a minimum of 6 months, unless you're looking for trouble. I've sat lectures which say it always collapses. I says, he said, and we hold it all of 3 months. I says, that's your problem. You didn't read my papers. It has to be done minimum of 6 months, and then you slowly remove it to make sure. Decreasing pressure, and you keep slight pressure on for 6 months.
How did this palate expander change the dental field?
It eliminates 80-90% of the extractions done for orthodontia. It makes some very lucrative surgery is avoided. Of course, what they did, and they're still doing, cutting both jaws off from the skull, moving around, sewing back. Or a palate expander, and reverse pull headgear with rubber bands, which I use mostly rubber bands. It does the whole thing. When somebody's too old for that, I do a little surgical assist. So I can move the bones, the sutures, move it, and done that for adults. 25, 26 years of age.
While growing up, were you active in sports?
I had major letters in track, wrestling, handball, tennis, and swimming. On the side, I did football, baseball, and basketball. Taught swimming, canoeing for the American Red Cross.
What do you find most challenging in the dental field?
I like doing everything and go to the way things are going to be least pain and least expensive. Patients, my family always believed in try and keep things in the reach of people. New York is getting a little rough that way because we've had phenomenal increases in rents. And you have to pass that on, unfortunately.
Have you done any public speaking or lectures?
I used to lecture, at Harlem Hospital. Officially, I was number 2 on the staff. I spent my time teaching. And I've lectured for the American Orthodontic Association. And I've given lectures away in Israel and Canada. I was a delegate to international meetings with the Alpha Omega Dental Fraternity.
Where are your dental offices located?
My office locations are 340 Madison Avenue, Suite 4B in Manhattan. Phone number 212-286-0486. My Westchester office is limited to orthodontia and head and neck pain, whereas in the Manhattan office I do everything. The Westchester office is 267 North Ridge Street, Rye Brook, New York. Phone number 914-939-3779.
Spotlight Radio would like to thank Dr. Stanley Okun for his time with us today. This has been a Spotlight Radio production.